Hi everyone, welcome back to another episode of the Breast Cancer Physio. I'm your host Jen McKenzie, Lymphoedema Physiotherapist and ESSA accredited exercise physiologist. In this video, I'm going to cover the topic, can injections trigger lymphedema? So without further ado, if you enjoy this content and you would like to see more, then please give this video a big thumbs up, subscribe to my channel, and leave a comment in the section below if you have any questions around needles, lymphedema, or any other topics around breast cancer. I'd love to hear from you and find out what topics you'd like more information on. So let's firstly talk about why we actually advise patients to avoid needle stick penetration on the affected arm. So the affected arm, which I'll refer to throughout the length of this video, is the arm which has had lymph nodes removed. Now for some people that might be both arms. So if you've had a bilateral sentinel node biopsy or a bilateral axillary lymph node clearance, meaning you've had lymph nodes taken out on both armpits, or if you've had radiation to one or both armpits, then you are at risk of lymphedema because of those treatment techniques. So the guideline that often is provided to patients who are at risk of lymphedema is that if at all possible, they should avoid needle stick penetration on the affected arm. So the three main types of needle stick penetration that we're referring to in this video are number 1, vaccinations, number 2, infusions, and 3, blood draws. So if anyone's ever having a blood test during their breast cancer treatment or after their breast cancer treatment. So let's just go through the concept around why needle stick penetration is a problem. So commonly people don't realize that it's not actually the needle stick penetration that's really the major issue. For me, and from what I've seen in my clinic over the last 6 years, it's more about the circumstance if a person gets a needle stick injury from when they're having a vaccination, blood draw, or infusion. So if someone is trying to, like a health professional is trying to find a vein to access blood from, and they really struggle finding that vein and they start to make multiple attempts and they create inflammation and bruising around the site of multiple needle stick penetrations, then that can, I believe, be a trigger for lymphedema. So it's not so much the needle stick penetration that's the problem, it's the inflammation caused by multiple attempts or by even injecting into a space that's where the injection is not meant to go. And I've seen that before. So there's a lot of pushback from some medical professionals to say, or allied health professionals or just lay persons who will say, oh, you know, that's rubbish, you don't need to avoid needle stick penetration on your affected arm. But every now and again, patients will come into my clinic and they've been referred for lymphedema, and it's not a common circumstance by all means, but again, this is where I love giving education through these videos, because if this is something you can easily avoid, then why not avoid it? So every now and again, a patient will present with lymphedema, and the reason behind their lymphedema is that a needle stick penetration went wrong. So either there was a hell of a lot of bruising and inflammation that was created with the needle stick penetration going badly, or they just had a really significant lymphatic response to that needle stick penetration. So this is another reason why vaccinations are not a great thing to have on your affected arm. So like I said at the beginning of this video, the affected arm meaning the side that's had lymph nodes removed or the side that's had lymph fields radiated. So vaccinations are literally the injection of a dead virus into your arm, and they will naturally cause some sort of immune response. And so because your lymph nodes are part of your lymphatic system, which is part of your immune system, if you've had lymph nodes removed under your arm and you put a vaccination into that arm, you're essentially expecting your lymphatic system to work very hard to overcome the effect of that vaccination. So the take-home story with this whole video, guys, is that if you've got a good arm, so to speak, to use, meaning a arm that has all its lymph nodes intact or no fields that have been radiated, then you may as well use the non-affected side. Another quick note, because this topic does semi-fall into this video, people often ask about blood pressure testing. So again, it's the same message, and it's certainly in our current prevention guidelines. I'll put a little tag up above me here on my other video, which is called Current Prevention Guidelines for Lymphoedema, because that video goes into all of the detail around the current do's and don'ts for risk of lymphedema. So with blood pressure testing, again, it's within the guidelines that we avoid blood pressure testing on the affected arm. So if you can use the other arm for blood pressure testing, by all means go for it. However, I will put a small note here and say, in my 6 years of experience as a lymphedema physiotherapist, I've never actually had anybody present with lymphedema after they've had a blood pressure reading done, but obviously it has happened out there. So again, if you can use the other arm, go for it. I think in what I often tell my patients is, if anything like this accidentally happens, so say if you got blood taken from your affected arm, or you accidentally got a blood pressure test done on your affected arm, it's not necessarily a reason to panic, because if nothing went wrong per se, if you didn't get any bruising or any obvious inflammation at the time that either the blood pressure test cuff was on or the blood drawn was performed, it would just be a means of monitoring your arm. So if you get any signs or symptoms of lymphedema, and I can put another little card up above this point now for signs and symptoms of lymphedema. I've got another video on those on that topic. So if you monitor your arm and nothing goes wrong, then fantastic. But again, it's just a good healthy practice to get into, that you avoid things like vaccinations, infusions, blood draws, and blood pressure testing on your affected arm. Now, finally, I just want to make a point about what can you do to avoid needle stick penetration on your affected arm, because understandably, a lot of patients might know this information, that they're supposed to avoid all of these things forevermore after lymph node removal or lymph node radiation. But then they encounter situations where a health professional or a medical professional might be attempting to take blood or do a blood pressure test or do an infusion or whatnot on their affected arm. And they are in a little bit of a dilemma, because they're thinking, oh my gosh, does this medical professional not realize that I can't have this test performed or this procedure done on this side? So first and foremost, get yourself educated, and I think it's fantastic that everyone watching this video hopefully will be educated by this point, but particularly if you've got friends, family, colleagues who you know are at risk of lymphedema, then certainly spread this video around. But yeah, certainly get yourself educated as to why it can be a problem. And as I mentioned beforehand, it's not so much if everything goes smoothly, it can be if something goes wrong. But certainly in the circumstance of a vaccination, it might be that just a really big lymphatic response is created, and that could be enough to overtax your lymphatic system and trigger a little bit of lymphedema. So yeah, have your own voice and be ready to stand your ground. If you do not give consent for your arm to be injected, for blood to be drawn, for a blood pressure test to be performed, then that medical professional or health professional is not allowed to perform that procedure. So one of the products that I wanted to show in this video, guys, is a wonderful little medical alert band. I'll just see if I can get this into focus. This is a lymphedema alert band. So it does say axillary lymph nodes removed on one side. And then if you turn it around, it says no blood pressure tests and no needles on that arm. So these bands are fantastic, particularly if you know you have to go into hospital and that there will be multiple blood tests being performed for a few days in a row, or if you're going into a medical clinic, or if there's just a circumstance by which you want people to be alerted to the fact that you don't want blood pressure tests done or needles stuck in your arm. So these are really great little bands. If you do feel nervous and you don't want to have anything happen, particularly if you are under the under a general anaesthetic or twilight sedation because of a medical procedure, these bands are great. I'll put a link to where you can buy these in the description below. The final piece of advice I've got to prevent needle stick penetration on your affected arm is make sure that you communicate this to your medical team, particularly in circumstances where you are going for maybe a procedure that's not necessarily even related to your breast cancer treatment. So as an example, I had a patient who was going in for an ablation because of atrial fibrillation, so a cardiac problem, and she was going into literally in the pre-op waiting area, and the anaesthetist wanted to put the cannula in her affected arm, and she was sedated by this point, and she really didn't have the energy to sort of fight the anaesthetist to, say, hey, like, I really don't want you to put the cannula in that arm. So before you even are sedated on the table, I really feel like it would be a great thing for patients to make a strong communication to medical teams, particularly if you're going in for surgeries, procedures where you will be sedated or put under general anaesthetic, that nothing should be done with your affected arm. So communicate with your medical teams, make sure they're alerted to the fact that you are at risk of lymphedema, or if you have lymphedema, that's another reason why you want to avoid needle stick penetration on that side, because it can worsen existing lymphedema. So just another reason to make sure that you're educated on this topic. It doesn't matter if you are at risk of lymphedema or you have lymphedema. Vaccinations, infusions, and blood draws and blood pressure tests should be avoided on that side. Thank you so much for listening, guys. I hope you've gained some great information from this video. I release a new video every week on the topics around breast cancer. If you have any questions around needle stick penetration and affected arms, then please leave a comment in the section below. If you've enjoyed this content, then please subscribe to my channel and give this video a big thumbs up. I hope you're having a fantastic week wherever you are. I'm Jen McKenzie, the Breast Cancer Physio, and I'll see you next time.